just first and foremost want to thank all of you for coming in. I'm so excited. We highly encourage everyone to turn on their cameras. Oh, Mark's trying to find his cat. That's cute. So I know it's Bridge Club. I'm going to call it out.
No, it's actually, Catherine, it's serious. This is a cat that would never leave. I will probably speak in the first 15 minutes and then I'll have to excuse myself. I apologize. But and Allie knows this is a cat that wouldn't leave a source of a meal for a minute, but he is nowhere. So I'm going to have to find him, obviously.
So Mark, if you need to exit and come back, we will definitely.
No, he's not going to move anywhere in 15. I'll start out and then I'll have to jump off. Excuse me.
Yes, we'll get you in here as fast as we possibly can. So for those of you who are new to the Bridge Club, the whole purpose of this is to elevate the profession and bring our voices to light on issues that are important. We highly encourage you to turn on your camera. Paul, thank you for turning on. Jessica, thank you for turning on yours. Really excited when people, Diane, thank you for turning on your camera. This is really how we make this happen. We also know that human communication relies heavily on face-to-face communication. As we wear masks, it gets harder and harder for our messages to be sent. So we are so excited. And thank you, Scott, for turning on yours as well. Tonight's conversation, I do need to say, first of all, first and foremost, happy Veterinary Technicians Week. Mark Cushing, who is the founder of the Animal Policy Group, as well as one of the co-founders of VVCA, but most importantly, the author of Pet Nation, brought this topic forward to say, listen, we really should celebrate the role that technicians play in this profession, but more importantly, that their role in virtual care is essential to its success. So I really want to applaud Mark for bringing this conversation forward. We're going to be honest about some of the challenges, but we're going to really help address a lot of those questions that you may have. Tonight, we're also going to be joined by Nicole Rogers, who, while she has many amazing credentials, which I will give a few, most importantly, I do want to point out that she is a veterinary technician and has really been pivotal in the creation and operations of Whisker Docs. Not taking anything away from Deb Leanne because she's the founder and she is here, but I do want to indicate that Nicole is really an incredible asset to that company, and she is the VP of operations. We also have a few board members from the Veterinary Virtual Care Association, including the executive director, as well as Allie McIntyre, and we have Aaron Smiley, who will be jumping in as well. But because I'm so excited, we also have our very own Chief Veterinary Medical Officer of the Bridge Club, but also a practicing veterinarian and also founder of the VVCA. We have Cheryl Good with us tonight. So we have a full platform of people, probably I think one of our most amount of guests we've ever had, which is awesome. So for those of you who've been to the Bridge Club before, what do we do first?
Drink.
Raise our glass. So everybody, raise your glass. Our toast tonight comes from Nicole. So let's get started, Nicole.
All right. Well, in honor of Vet Tech Week, let's raise our glass to all the veterinary professionals out there, our forgotten heroes who've been working the front lines through all of this and helping all of our pets in need.
Cheers.
Cheers.
Because Mark has to go search for his cat, let's let Mark have the floor first. Why are we having this conversation, Mark?
First, I want to also introduce Deb Leon, Jessica Vogelzang, and we have another, I know we have another VVCA board member here, if I haven't called you out.
Oh,
it's
Bruce.
Truman. Bruce. Great.
Audrey.
So, thanks.
Audrey,
and Audrey Weistrick, I think, is joining us. So let me tell you what the conversation's not about tonight. It's not about ways that veterinary clinics should efficiently deploy all their talent and internal processes, way above my pay grade. But there's a predicate question before that the VVCA is very focused on, namely, with a lot of people, possibly no one on this Zoom call or this Bridge Club, for a lot of people, they don't understand the wide latitude, almost infinite latitude with which vet techs, particularly credentialed vet techs, can be the source of information, participate, handle virtual calls, virtual engagement without a veterinarian guiding it and without a veterinarian on the call, but there's a misnomer about very limited things that a vet tech can or can't do or can or cannot talk about. And you have this incredible, well-trained and well-experienced professional resource that needs to be integral to a successful practice's use of telemedicine for all sorts of good reasons. A, to give really quality care to pet parents, but also to help relieve the stress that's experienced throughout all practices right now because of the surge of interest in care on the veterinary side, the vet tech side, the vet assistant side. You know, I get all that, but the vet tech, underutilized as she or he is already, is at risk of being grossly underutilized in delivering virtual care. So for VVCA, it's not a veterinarian organization. It's a veterinary care, and that covers everybody on the team. So that's the urgency of it, Catherine. And then I'll talk in a moment about the particulars of practice acts and why vet techs are not nearly as restricted as some people think they might be.
So maybe we jump to that really quick, Mark, because we want to make sure that you're able to deploy yourself. But while you're talking, I am going to go ahead and launch a poll for everyone to answer, and then we will jump over. So we'll modify our agenda just a little bit to help you, Mark. So can we jump in on what this Practice Act thing is and why people are freaking out that they could lose their jobs?
So here's the misnomer. The misnomer is that unless a Veterinary Practice Act, which is an act enacted by a legislature, not by a vet med board, but by a legislature, who do the same thing for all the professions, there's a misnomer, as in it's false to think that unless it specifies something a veterinary technician or veterinary nurse can do, otherwise they can't do it. So there's that it's a very limiting factor. Let me tell you what Practice Acts do and don't do. All they do in all 50 states is define under the very precise term veterinary medicine who can provide who can conduct veterinary medicine. And they start with the veterinarian, and they basically all say the same thing. Only veterinarians can perform surgery. Only veterinarians can prescribe medications. Only veterinarians can provide diagnosis or prognosis, i.e. treatment in that broad sense. Otherwise, they leave to veterinary technicians or nurses in many states a whole range of activities they can and can't do. But what they don't do at all, and this is the point of this evening's conversation, what they don't do at all is define pet care. They don't define quality professional advice to pet owners about behavior, about nutrition, about all sorts of symptoms, about all sorts of things going on that particularly new COVID pet owners, particularly puppy and kitten owners, want to talk to professionals about. And they can talk to a lot of people. But if they naturally lean towards a veterinary clinic, they can get all the advice in the world on a whole range of topics, good, experienced advice from a veterinary technician, and they never need to talk to a veterinarian about that, perhaps. So there's this opportunity, and I know Carrie O'Hara, researcher extraordinaire who's on the call, has done so much work in this area. Millennial pet owners and Gen Z pet owners, they want to do a lot of the pet care themselves. Good for them. You know, we all do, just as we all want to take care of our own selves as best we can. And what we want for ourselves is what? Tell me what I need to know so I can live my life, conduct my affairs, not drink too much great Oregon Pinot every night. And I'll live longer and happier, right? Well, pet owners aren't any different. They want to know what can they do, what should they do in situations, not just dire situations, but just day-to-day situations with their pets. I put that under the banner of pet care, and veterinary practice acts are not pet care practice acts. They're not pet wellness practice acts. And I seem, charged up and emphatic about it, but there's this myth that unless they tell a vet tech you can do this, everything else you can't do. So you're gonna hear from a lot of smart people that are experienced tonight about what those examples are. And I think, Nicole's a super example because of the Whisker Docs work that she heads up. as well as the VVCA board members, a good example. Aaron Smiley does telemedicine even when he's sleeping, will tell you what a vet tech can and can't do. And if we leave the evening understanding that, I think we're better off. I think we'll just have a better sense and begin to create in veterinarians' minds the comfort that they can deploy their team at so much higher level in everything, but particularly in the virtual care space. So with that, I'll go find.
You're gonna go find your.
I'm gonna go
and
find
then if
Oscar.
you come back, we'll catch you up
Yeah.
where you're
Yeah,
at.
I may not be around
Yeah.
if I don't find Oscar, but I'm gonna go find Oscar. Thanks.
Okay. All right. So we're gonna kind of, it's funny because, you know, for those of you who've been on the Bridge Club before, we have a run a show. We try to follow the run a show. That's now been blown up. So we're gonna start, and I am gonna have us back up just a smidge, because I do think understanding kind of the parameters that inspired this, but part of what we talked about when we promoted this was, Allie, I do want to have you jump in really quick and explain, why are technicians going to be the key to success for virtual care? After this, I'm going to turn it over to Nicole to really help us explain what the hell is virtual care.
Great. I think that's a really important question. And I think most of us can say that we believe truly that for veterinary practices, the use of telemedicine and virtual care tools can be a lifesaver for the team and the animals they care for. I think the key here, however, is to take the time to properly implement the tools so that vet nurses and staff can create effective and efficient workflows. And I know that, you know, specifically, this was a conversation not about workflows, more about what a vet tech can do. I'm here to say that, you know, kind of like, here's the elephant in the room. We know that everyone's overwhelmed. We know that everyone is overworked. Let's find a way to implement the practice correctly. And every practice is different. So it's not, you know, it's not a Band-Aid one size fits all approach. It takes time. There's a learning curve. And I think vet techs and vet nurses are ripe for that elevation. You know, we've talked for years about trying to get vet techs and vet nurses to be utilized at their highest potential. And this is a great way for that to happen.
I think that's huge. I think, and I'm just really quick, Bob, you shared, you know, when you come to the Bridge Club, you're getting called out. But Bob, you shared a number with me today. What % of technicians are using all their skills?
I don't know that I know that number. We could probably all guess, but I was making the point in an earlier conversation with Catherine. We probably all saw the APPA survey this week that indicated 11.4 million new pets just hit homes during this COVID pandemic. I don't think we saw a commensurate number of new vets and veterinary nurses enter the profession. So clearly we were busy already. We have a workforce shortage. There's not going to be fewer pets. There's not going to be more workforce coming. How do we treat more pets with less vets? Well, to me, clearly the answer is technicians and technology. That's where we've got to get to. And we don't, the percentage of how, to what extent of their license do we use vet techs? I'd be guessing, but I'm guessing it's way south of 50%.
So does anyone know that number? Because again, at the Bridge Club, you're all unmuted. Does anyone know that number? Okay, maybe it's something we need to find out. Carrie O'Hara, you have a new job. So, gotta find out.
Hold
Wait,
on, Catherine. I'm
know?
happy to
Rebecca
jump in
knows.
on those.
Rebecca knows.
So if we look at a grading scale from A to F, which is something that has been proposed, and we've got some statistics there, well, you guys are going to be getting about a D. A, B, C being, well, you're utilizing them to the somewhat, but I think you're getting more D's and F's as to the full utilization of a veterinary technician. Now, keep in mind, I've been doing this for 30 years, and I know there's other people on this call too that can probably talk about that, but we are not utilized to our fullest extent. Period.
So let's talk about how we can. So Nicole, you're going to be on, but before we jump into that, can you explain? So obviously this is being brought forth by the Animal Policy Group and the, you know, talking about the Virtual Veterinary Care Association. So this term virtual care, that's a big term. Can you break down what virtual care is? And then we want to go in what Mark said, what can we do in those, but what is possible?
Sure. And that's a great question, and great place for us to start. So really, we're talking about an entire ecosystem of care that includes upfront triage, so teletriage, and utilizing technology to conduct that and capture medical histories. We're talking about comprehensive education that's delivered electronically. That's sort of the telehealth umbrella, so to speak. And telemedicine, which is using technology to aid in the remote diagnosis and treatment of medical conditions. So that's really, it's this entire ecosystem all wrapped up together is what virtual care is really all about.
So I do want to point out, so for those of you who don't know, Nicole is with Whisker Docs. So Nicole, explain what Whisker Docs is, and then let's go in and talk about the conversations that you do have at those different points in virtual care.
Absolutely. So Whisker Docs is a 24/7 veterinary telehealth service. So we provide a combination of both telehealth and teletriage, referring back to what I was talking about before, with a focus on what we call decision support. We triage a pet's condition and help drive them to the appropriate level of care at the appropriate time, and provide robust education around why that level of care is needed, the signs, symptoms, and upcoming, conditions to watch out for.
So can we go through where, like, the experiences of what you generally cover in conversations and how far those can go? Is there a line in the sand, like where it says, no, we can't have that conversation, for technicians in particular?
Absolutely. So, really, there are very few limits in terms of what a virtual care ecosystem can offer. We always focus on exploring new ways to expand our reach and build the trust and build that bond between the pet owner and the veterinary profession as a whole. So we're not really intending to completely replace in-person care, but our conversations will range from everything from, a toxic ingestion and driving the person to an emergency room, or a life-threatening, a foreign body, for instance, driving them and helping them get to urgent care when necessary, to, those really mild cases of, oh, my dog just started vomiting and we're going to provide a bland diet or recommend withholding food just to get them back on the right track before rushing in for an appointment, wasting funds, not using resources appropriately for the pet owner. And then for the veterinary industry, we've been talking, the whole theme tonight is about how there's too many pets and not enough vets, right? So getting the people in when they need to go in, and building that trust with the consumer that it's not always you have to come to the office, right? There's so much we can do without even seeing the animal. Now, is there a line in the sand? Absolutely. In the absence of a VCPR, and we all know that's one of the biggest barriers, right? But unless you have assumed responsibility for treating that pet in most states in this country, you cannot diagnose or prescribe without a VCPR. So that's one of our bigger challenges. And of course, Mark's off looking for his cat, and he's the pro on talking about the VCPR. But that's really where the line in the sand would be.
So I think this is what I love about this. I do want to share with you all some of the results of the poll, because this will help guide our conversation before I turn it over to a practitioner. So I do want to make sure that we're giving the whole story. We're not just talking about a telehealth company or we're going to talk about private practice. We're going to talk about a few other things. But so as we go through these results, people, I do want to indicate that almost 35% of people were not in this room, were not practicing any kind of virtual care prior to COVID. And that number is about 25% right now are still not We're going to get to a question on that here in a moment. One of the other questions that we asked was, do you utilize a pre-built technology platform? And we have about 75% yes, we have 25% no. And then, do you like that technology? 15% no. So there's got to be some real innovation of people that are not really enjoying that. So just giving you all kind of a lay of the land. So if by chance, if you feel comfortable, if you do not, that's completely fine. I'd love for you to post into the chat a barrier that is causing you not to be able to do telemedicine, just to share openly and honestly about where the profession is at there. I'd love for you guys to be able to do that. But Erin, I'm going to turn it over to you. So I'm going to have you unmute yourself. I'd first like you to talk about your practice in general, so people know where you are in your practice overall. But I really want to hear about how you're using telehealth and telemedicine in your practice, and then we'll dive it deeper a little bit there.
All right. Aaron Smiley practice. Yes, we got the cat. Oscar found. He was lost and now he's found. Miracle. Count it. Count it.
Oscar.
I have to have a little motivational discussion with Oscar. I'll be right back. Excuse me.
I love it. So I practice small animal medicine in central Indiana, in a Rust Belt town. Most of my clients that have financial means are retirement age. Then the other population, if they're not retirement, are working blue collar or non-working poor. So that's kind of the clientele that I see. And then what was it? How am I using it?
Yeah. So talk us
How
about
am
how
I
is
not
it
using it?
used?
Okay, how am I using it? Well, specifically for technicians, what we have in the town, we have not enough veterinarians for the amount of people that need to be served. So what we do is we utilize technicians to take 1.5 doctors and almost create another half of a doctor. And the way that we do that, because in the state of Illinois, or in the state of Indiana, I used to live in Illinois, we veterinary nurses and technicians and even assistants have a wide latitude with a veterinarian in the building. So with a veterinary assistant, there's direct supervision. So in Indiana, I have that permission. So what I do is I'll interact with a client on the telemedicine platform. I'll say, hey, we're going to create a nurse appointment. If I can't manage the whole thing, we'll have a nurse appointment. The nurse will take care of everything underneath my direction. I'll diagnose and prescribe on the platform. Then I'll never interact in face-to-face with the client. The nurse will take care of everything. So do you want me to keep going, Catherine? You
Yeah, I do. But I'm telling you, we got a question from Michael. We're going to have to address here in a minute because I think he's not alone. So,
hello.
Yeah, so you keep going and then we're going to jump in. We're going to, again, I love that I put us on a show together and it gets thrown out the window.
Ah, boy. Okay, so what we'll do, so 3 specific cases that I've done in the last 2 days. Corneal ulcer. Owner sends me a picture and she says, hey, Dr. Smiley, Fido is winking. There's something wrong with Fido's eye. Yeah, send me a video of that. So she sends me a 10-second video. This is all asynchronous. I don't do any synchronous telemedicine. Don't have time for that. So asynchronous. So she sends me, I'm highly suspicious of a corneal ulcer. I tell her, I say, I'm highly suspicious of a corneal ulcer. And this owner said, great, give me the medicine. I said, you can't have the medicine until I stain that eye. There's no openings in the schedule right now, but I can make a nurse appointment. So then what happens is my schedule's booked. The client, so I can see the pet. I already have a VCPR. So this is an established client. They come in, the nurse interacts with them. The nurse stains the eye. She takes a picture. She puts that on the platform. In an asynchronous fashion, I look at that and I have written protocols. The nurses know what to do. If they're staining and the pressures are normal, they know what medicine they're going to reach for. They put that, Dr. Smiley, here's the corneal ulcer that we appreciate. Here's the pressure. Here's the medicine that fits our protocol. I say, yep, good to go, corneal ulcer. I've diagnosed, I've prescribed, but the nurse has done all the work, which is pretty typical for my clinic anyway. They do all the hard work. So corneal ulcer, we do that. Otitis, we do tons of otitis. Well, what do you think of otitis? Owner sends me a video of the ears. Fido's shaking its head. Great, let me see those ears. So they send an asynchronous video. Woo, that looks like a lot of erythema. I'd like to get a cytology, but this guy doesn't want to do it. My schedule's full, but the nurse can take care of it. They're very good at reading cytologies. So the client and the nurse interact. She does everything. Again, takes a picture underneath the microscope. Dr. Smiley, I'm seeing 2+ yeast, 1+ cocci. She follows her protocol. She knows what medicine to put in the ear. She flushes the ear. I diagnose on the platform. I say, oh, that's otitis externa, and we're going to use Claro. And the nurse, again, does all the work, because she always does all the work. And then the owner goes on their way. I have saved myself not just time, but allowed myself to be far more utilized, because we have a lot of animals that need veterinary care that can't get it right now. So my nurses are motivated because they know by using telemedicine, we can serve more animals, and that motivates them. And they get a kick out of the fact that they're running the show inside what Mark said, the parameters that they cannot diagnose. And you ask any nurse or technician or assistant in my clinic, they don't diagnose, they don't prognose, they don't prescribe, and they don't do surgery. Outside of that, the barn door is wide open.
So I'll just say, Angel loves what you're saying. She's starting to laugh. She's like, that's right. We run the show.
Bingo. It's true, right? It's true. That's right.
He's
That's
like,
right. That's
we're
right.
the ones that are making it run.
That's
And I
right.
think
Right. But we have written protocols. So it's the safety as far as being the practitioner, because at the end of the day, the buck stops at my desk. So if she makes a mistake, it's my fault. And I highly trust the people and the staff that's underneath me. And we have protocols. So they're not making it up as they go. They're not acting as doctors. It's very prescribed in what's going on, but it allows us tons more, we can treat so many more patients and care for more animals. I mean, that's the thing that's so nasty about where we're at right now. Is there's a lot of people that would like to get veterinary care for their animals. And there's just not enough slots in the day.
Okay, so let me ask you this. How long have these protocols been in place? How long did it take you to put these protocols in place? Because you have practices right now that are literally like can't even breathe.
Yeah, okay, not long. And the reason is because it's what everybody's doing. So take 30 minutes, literally 30 minutes, and just write it down. This is what you're doing every day. This is not the first time any practitioner on this phone call has treated otitis. Right? If you're a small animal practitioner, you treated 5 cases of otitis today. Well, okay, that's a pretty simple algorithm. What are we looking for? We want to make sure it's not Pseudomonas. Is the eardrum intact? I don't check it every time. Some practitioners might, but I choose drugs that I can use even if the tympanic membrane is ruptured. So I try to find medical cases that are simple algorithms that we do all the time. I'm not going to write an algorithm for Addison's. I can't even figure out Addison's sometimes. I'm not going to write that protocol. Fleas, I'll get you a protocol. Otitis, you betcha. Corneal ulcer, I can grab that one.
So as we look at like, where do you see this going for your practice? Because if you've got the protocols in place, are you maxed out?
Not with my nurses yet, not with my technicians. So what I'm doing right now is trying to hire more registered technicians. And here's another dirty part about the profession. Is there a lot of people that have some type of education, but for whatever reason, there's an impediment to becoming licensed. And what I'm excited about is in our practice, to be able to allow the veterinary nurse and the licensed technician to generate revenue so that we in turn can pay her a much better wage. You look at dental hygienists, they're no more skilled than a veterinary nurse. The veterinary nurse physically does a lot more. If you're a dental hygienist, God loves you. I'm not trying to beat you up. But think about the skill set that a veterinary nurse has compared to a dental hygienist. Those dental hygienists make crazy good money, and they ought to. But what they're doing is they're generating dentistry. And in turn, the dental industry can pay those people quite well. There's no reason that the veterinary nurse can't start to generate veterinary medicine under the current practice acts that we have, like Mark was describing, and then quickly in turn generate much more revenue for her own pocket.
So I think Serena brought up a really good point, and I don't know if it is Shirley Michael or Michael Shirley, so I apologize for that. We'll get to that question in a minute. But I do think Serena has a good idea. Let the text write up the standard operating procedures and have the vet fill in all the blanks. But I guess everyone's agreed about Addison's. They're little, no one can figure it out. So everyone's agreed.
Right, I'm out. Right, DKA, I'm out. I just quit on those. I'm like, is there somebody down the street?
So I think this is a valid question as we're going through, and that's part of what we do is the questions can come up at any point in time. But as a practice owner, I do worry about turning my LVMTs into loose on telehealth platforms. Does this open us up to more liability? I'd feel much better, sorry, that was Catherine's language, about if they were afforded the same insurance protections that our DVM share. I wish they would be recognized like they are in human med. So who wants to jump in on that one?
Can I do one and then I'll be quiet?
Sure.
Okay, my technicians, my nurses, my receptionists are on the phone all the time, way before COVID, way before I even offered telemedicine. There's no record of what those people are saying on the phone. They're offering telemedicine already. So it's a misnomer. You're already setting your entire staff free on telemedicine. They have free reign right now, unless you're hawking over them on every phone call and going back with a fine-tooth comb. What I love about the platform that I use is everything is documented. This is far safer than my staff operating on telemedicine on the telephone. When they operate with telemedicine on a device, way safer. It's all preserved. I can, honest to goodness, go back and critique what they're going and make sure that they're not getting off the rails. So for me, much, much safer.
Catherine, I'll be real simple. As long as they do not prescribe medication, which they won't, as long as they do not perform surgery on the phone, which I hope a veterinarian doesn't either.
I don't think we can do that.
And third, as long as they don't diagnose or issue a prognosis of the specific condition, as long as they don't do that, no veterinarian has any liability for a conversation that a vet tech has on the phone, unless the vet tech said in advance, I'm going to guarantee a winner in the 7th race at the Preakness, and the veterinarian says, go for it, tell that client he's loaded, and unfortunately the horse doesn't win. I mean, seriously, it's that narrow of a limitation. And everything a vet tech does is not something that a veterinarian has inherent liability for. And I remind everybody, liability in a veterinary context is extremely limited. It's property damage, cost of the pet, cost of training, cost of replacement, and medical services. So, I mean, not to be crude, but that's the world we're in. So the exposure isn't what that doctor fears. I understand the rationale for the fear, but.
Oh, go ahead, Rebecca.
Thank you. Hello, Ralph. Ralph and I've been doing this for a long time. When I became the first paid administrator to the Technician Association in 2000, so 20 years ago, Ralph was also the first, he just stepped into his executive director role. And one of the first things we had to collaborate on at our state in Colorado was we had the conversation with our state board and the CVMA and the Technician Association, really truly dissecting what it was we can and can't do. And it became very evident through the past 20 years of me doing this. Veterinary technicians who are formally trained know explicitly what we can and can't do. I'm going to speak for myself, although I probably am speaking for many of them. We want to be the hands and the heart of delivering medicine and delivering veterinary care. We don't want to be the veterinarian. That's never been in our genome. That's never been in our makeup. We know and understand explicitly what we can and can't do. And it's the question I had earlier too is, of the people on this call, who's even been to a state board meeting where you actually know and understand what those cases look like and how they're being brought forth? Because I think if more people understood how the state boards or governors or how those entities work, they're going to realize that, oh, we do have some definitions here. We do have some leeway. We do have ways to make this successful.
So I love that, and thank you for that. So I want to be able to just pivot just a little bit because, and actually Deb and Nicole may also want to jump in on this, Mark, but this is directed at you. Aaron may want to jump in as well, but you know, is this all this emergence and this surplus of people wanting to be able to have all these calls? Would we be where we are today without COVID?
No, it'd be silly to say we would be. We'd be there in 3 years to 5 years. And Deb, who looks like she just finished college, would be like, you know, a 3-year out of college, you know, looking for a next job. No, the truth is we wouldn't even be close to it. So COVID, but you know what COVID did? COVID screamed at human healthcare, everybody get to telemedicine right now. It turned to veterinary and said, you're an essential service. 25 states said, get to telemedicine right now. And people tried it. You know, we have 3,600 members of VVCA right now. Who'd have predicted that? And it wouldn't have happened, but you need external events sometimes to cause people to stop and I'm going to just say this because it's the issue. We have had theoretical, speculative, philosophical arguments against telemedicine for 10 years in the last 5 years. It's bad medicine. It's substandard. Pets are going to get hurt. Let me tell you something. In Ontario, they've had it for 3 years. And on the record, they've said not a single complaint. I've written a letter on behalf of VVCA to 15 state medical boards that relaxed the rules. I said, tell me the number of pets that have died or been injured because of negligent use of telemedicine. 0. The FDA relaxed it 5 months ago. Same question, 0. So the truth is, at worst, telemedicine is harmless. At worst. At best, it helps people. And the arguments anymore can't be the sort of, dream it up fear that veterinarians, are just, roaming around the country on the phone, harming pets. They're not doing it. And so did we take advantage of COVID? No, but COVID clearly created a condition where people were forced to try it. And, Rebecca's a good example. I mean, she knows all her colleagues in Colorado. They're just, the practices are using it. Ralph knows that. He's got a national job now, but when he occasionally looks out the window at his home state of Colorado, he sees the same thing, right, Ralph? I mean, veterinarians are using it. I'm not putting you on the spot, except I am. The truth is they're using it and it's working. So we're not going back to February 2020, Catherine, but where we go next is a separate Bridge Club topic because it's not a given. There are states already trying to pull back because people are afraid that we've gotten momentum. Well, guess what? We have, and
Okay, so I'll hold back my question because that is exactly where I was going to go, but I will stop myself. Instead, I'm going to get a little spicy. Are you ready? Because that's what we like to do here too. We like to ask the little spicy question. And that is that I've been seeing a lot of comments on Facebook. I've been seeing a lot on Instagram about this curbside drop off and that people believe that that is telehealth. Can we address, is that telehealth or virtual care? What is curbside and is that going to stick around and how does that play in the role of all this? So I don't know who wants to jump in. I think Mark, you may start with it, but I'd love to get some of the practitioners' points of view on this.
All I'll say, but practitioners should jump in and I'd love to hear from Bob Lester on this. I'm looking right at you, Bob, in the center of the screen. Sorry.
Yeah, you really are in the center. I don't know if he's on everyone else's, but he's right in the center.
Bob, he pays like, getting premium, Google reviews. He's like always right in the center. So it is telemedicine if the doctor or vet tech from inside the clinic gets on the phone with the pet owner in their car and says, this is a situation with your cat or dog or parrot or exotic pet. And this is what we're going to do. If it's digital and the pet owner is not in the clinic, it's telemedicine. It's not the heart of telemedicine, but it is using a digital tool. Telemedicine is virtual, meaning the pet owner and often the pet, but at least the pet owner is remote from the doctor or the vet tech or nurse, and that would fit that situation. But it's not the essence of telemedicine, but it is telemedicine. Yeah.
So I'd love to hear other people kind of jump in on that because there is this idea, gosh, that's what that is. We're having to communicate. Anyone want to jump in on that? I don't know if Paul wants to jump in or if we want Julie to, or if anyone else does, Camulin or Marianne. I just start calling out names. You got to watch out, it happens.
I mean, I'm not a practitioner, but I'm a technician, and I use telemedicine and telehealth in my practice for a while before COVID and during COVID. And so the way that we structured the definition of curbside was that it was a telehealth visit. The definition of telemedicine is that you are consulting with a practitioner that has a VCPR with you that can make a diagnosis and a prescription to you. The definition of telehealth means just getting triage or general medical advice. Well, when you're acting on curbside, even though you're seeing your practitioner, you're not acting through the phone when the client isn't there. The client is still there. You're just using the platform as a face-to-face to break that wall of them not being able to be in the practice. So when you say curbside, I think it varies to is it curbside truly where the client is outside in the car sitting at your clinic? Or is it curbside where you're like, hey, we're not having anybody come to the hospital, stay at home, which in that case, you're practicing telemedicine. And so it's important to define those two things. And so the way we defined at my practice using a telemedicine platform was that we were acting on telehealth because we weren't doing anything that we wouldn't normally be doing if the client wasn't in the room with us.
No, I think that's really valid. I had my first curbside this week, so I have to admit, it was my very first experience. And I have to be honest, the technicians were absolutely amazing and super sweet and very loving to my dog. So huge call out to every technician for this week.
And Catherine, I will add one small additional thing that I think really, there's a mixed bag on curbside as far as people's opinions on it. Yes, it falls in the you're not in person care. If you have the established VCPR, which as Mark said, there's really narrow sort of restrictions on that, but it's about meeting clients at their needs, right? And COVID has proven the value of that curbside. And again, you're using a platform to still be able to maintain the relationship, maintain the trust, provide the care for the pet. And it's a way that keeps them safe is the argument now, but it's just another way, another resource to utilize. So however we define it, I don't think it's going anywhere. I think that it has a place regardless.
So huge, big fan of Cami Lynn, by the way, me personally. So she has actually helped us a lot on the Bridge Club Pets and answering a lot of pet owner questions with regards to what's happening with the pet at the moment. Incredible, compassionate care. I just have to say, you are one in a million.
Thank you.
I do want to bring up the sensitive topic. And I'm going to actually turn this over to Dr. Cheryl because I do want to talk about, unlike Aaron, who's been able to create all the protocols, this seems to be working very well in his practice. I do want to talk about the big elephant in the room, and that happens to be the fact that right now people are overwhelmed. So Dr. Cheryl, can you walk us through what's happening in your practice and what your plan is moving forward, recognizing specifically, by the way, I do want to point out she is a practice owner. She's also the chief veterinary officer for the Bridge Club.
Yeah, thank you, Catherine. So when COVID started, my team, we finally had the right mix of people. So we have, 3 veterinarians, we had, 5 veterinary nurses, plus my practice manager, who is also a veterinary nurse who can pitch in if needed. We had 3 veterinary assistants and many front office people, and also people working in the back. And COVID hits, we lose a quarter of our staff. Quarter of our team. So of course that causes everyone to get overwhelmed, even more so, because now we're doing curbside and we're having more people calling in and being worried about their pets. So of course the amount of telemedicine that we were doing went through the roof, which I love it. And I'm doing everything asynchronously now because of Aaron. I'm not doing the video chats anymore. So, and I working with the VVCA, I really wanted to be able to start having my veterinary nurses also do some of this telemedicine. Now, of course, they are doing the teletriage, they're talking on the phones with clients, that kind of thing, but not using the platforms like the veterinarians are. But unfortunately, because of us being short-staffed and having this COVID issue and curbside, we haven't been able to do some of those things because I didn't want to overwork my team to where they would be so burnt out that all my good people would also leave. Now we've finally been able to hire a lot of people back. We actually had to close an extra day a week and, all of this just so I wouldn't burn out my team. But we are one of those practices that use their technicians to the hilt. I mean, they do everything that they were trained to do, but I hope in the future that, and I know some of my veterinary nurses have been very keen on wanting to jump on those platforms and do the teletriage and help out the doctors. So once this sort of simmers down a little bit, I'm very happy that we're going to be able to put that in place.
So I think it's an important piece. It's real, right? As practitioners across the United States are trying to deal with this, and whether they've got suddenly an employee that is diagnosed with COVID, that person takes them out of the mix entirely. And so it really changes kind of the makeup. We are getting to the end. I do want to make sure that if we have any questions in the chat, there were questions about, are there more examples like what Dr. Smiley is doing? Or Dr. Smiley, are you like one in a million? Do you, I am
My
curious.
mother always said, you are unique like everyone else.
But
I think we should hear from Audrey Weishrich. I think she's had a lot of experience and used.
I agree. I'd love to hear from her.
Just be curious. I've heard she's got some thoughts on this topic. I'll be curious.
Brilliant woman. Brilliant woman.
Oh yeah, she's got some thoughts.
I'm seldom silent for 45 minutes. So I've been sitting on my hands, so I haven't been able to touch the button. You know, I think a couple things are super impactful. Obviously, what Erin said is exactly what I endorse. And I think, you know, when you look at your licensed technicians and your nurses and your support staff, that is your first line of defense for triaging people. And to Erin's point, they're already doing all of this. So the fact that we've now identified telemedicine and teletriage and virtual care, we've just put names to things that everybody's been doing for an eternity. So we need to kind of strip back the reality that this is not anything different than what we've been doing. We have identified it, we've named it, and guess what? We've now started to charge for it. So amen. We have finally created a circumstance where we can put financial value associated with our nursing teams, where we can identify resources and give them opportunities to enhance and advance in their profession. We can encourage people to be more empowered. Veterinarians, by and large, have a very, very difficult time handing over the baton and understanding where they can rely on people without having to micromanage and babysit people. And we've got to stop doing it, because the failure in the profession is that everybody has to be everywhere always, and that doesn't work. That is not sustainable. And, you know, I think telemedicine is such an amazing opportunity for us to embrace people. And Catherine, you mentioned, you know, we have people who are going home on COVID who are no longer in the hospital. Guess what? Perfect opportunity, if they're feeling well, to work from home. And people who have circumstances that do not allow them to be in a physical space, guess what? Perfect opportunity for them to work from home. And so we need to look at deconstructing to reconstruct. We've got to unbuild the philosophies that we've been so beholden to for so many years and think of the world differently. And, you know, it's high time. And I've been preaching this bandwagon for a very long time with a lot of you guys. And you know what? Finally, people are realizing that we may have known what we were talking about. And we're not as crazy as everybody thought we were. And we're not as rogue as everybody thought we were. And so, you know, this in my opinion, this is one of the biggest silver linings of COVID that we possibly could imagine, that there are so many opportunities for our profession to advance and grow and empower people and give people a chance to finally participate to the level that they want to. So there's my speech.
Okay, so clearly she had a lot to say, which was really good. And we purposely keep her to the small part because she says the most important, impactful stuff at the end. But I will completely 100% agree with you. This is the silver lining. I think the veterinary profession overall has been elevated, and it has forced the veterinary profession to look at itself and say, how can we be a better profession? And I think technicians have won in this. I think technicians are the heart and soul of where we are going to go. And thank God for weeks like this. We don't need a week to honor you all, but we do need to make sure that we're honoring you on an ongoing basis. So with that, you guys, I do want to do some quick thank yous and then turn this over now that Mark has found his cat and he can do the closing toast, which, by the way, we're very excited that you have found your cat, is that I do want to indicate that this conversation is an important one. This is a pivotal conversation. And this is one that we will be having again and again. And thank you, thank you, thank you to Animal Policy Group and Mark for bringing this forward with the VVCA and with Whisker Docs and also with Dr. Cheryl. This is so critical. And I want to say Dr. Smiley, and making sure that we're calling out Deb and Audrey and everyone else. This is so, so important. And it does take a village to be able to change the world. It really, really does. And so Mark, my most heartfelt, great thanks for you bringing this forward. This is so critically important as we are trying to evolve this profession. So I've sucked up enough. So now we can go ahead and raise our glass. And Mark, because you know I love you, my friend. And go buy his book. Go buy his book. Go buy his book. So that's all I was going to say. Okay.
No, this isn't about that. This is really, honestly, everybody on this call, whether you were a true believer or a partial believer or sent here to see what the other side was up to, the truth is we're all in the middle, not the early stages, we're in the middle of a movement now. And it's a movement that basically provides access to care for millions, not tens of, but millions and millions and millions of pet owners and pets that choose not to or can't access veterinary care in the traditional sense.
Right.
And so now we're past the point of saying it's better that a woman in her 9th floor apartment at age 85 with her cat, it's better that she not get any veterinary advice on the phone unless she's willing to take that cat, risk her life, and find her way to a clinic. I mean, the point is, you're now part of a great transformative movement. And you know, Cheryl, I'm looking at you right now, you know, who you know, how much regard I have for you. And I know how much you've embraced telemedicine in a state that actually ordered it, right? Your governor said 7 months ago, use telemedicine, and you were ahead of her. But so you're on the winning side. I mean, it's just going to be interesting to see how long and what's the last state down the line and what that year is that says, hell no, okay, maybe yes, try it. So anyway, congratulations to everybody for being part of it, and especially to the vet techs and vet nurses that put up with a lot. And obviously you're motivated by a lot of good things. So thanks to you all. Cheers.
Cheers.